Thank you, Mr. Chairman. I want to thank you and the ranking member for keeping the focus of this committee on this important topic, mental health, treatment options, and trends. I wanted to spend my question time focusing in on a particular treatment option for particularly vulnerable children and bipartisan legislation that I've recently introduced concerning that treatment option. What is known as either therapeutic foster care or treatment foster care can be a ray of hope for children who have pretty serious medical, psychological, behavioral, emotional, and social needs. And under this therapeutic, or as it's sometimes known, treatment foster care model, foster parents are given special, fairly intensive training to address the needs of youths with major mental or physical health challenges. And then children receive intensive but in-home services to sustain them in the community. Therapeutic foster care provides critical services to what we estimate to be about 40,000 youth across the nation at any given time, and about 1,000 in my home state of Wisconsin. Mr. Arch, I understand that Boys Town has helped pioneer what we now know as therapeutic foster care or treatment foster care, that you've nurtured this model and been providing these services to at-risk youth for many years. I'd like you to share for the committee the Boys Town experience with treatment foster care and the ways in which high-quality services of that model can benefit these children.
Yes, we have operated treatment foster care, and what it is Boys Town very much believes in a continuum of care. And I spoke about the residential treatment center, which is the highest level of that care within Boys Town, and the treatment foster care would be a step below that. And it is for those kids, and for the residential treatment center provides an essential place where a child can step down. A child may not be ready to make the jump from a residential treatment center, very highly structured environment, to immediately go home or to another placement at a lower level of care. This is a great transition for that child where there is still continued structure. The other thing it does is it provides more opportunity to continue to watch the effects of psychotropic meds. So one of the difficulties in managing and reducing psychotropic meds in an outpatient setting, from what the physicians have told me, is that it is difficult because you're not watching that behavior. So you can manage, but the mom comes in and says, I need help. I mean, I'm desperate. I'm afraid. We're afraid. The child is really tearing up the home, and we need help. And so in a treatment foster care setting, you again have that longer view of behavior in a structured environment where you can step that down. So yes, we're very much in support. And of course, the states have a very different definition of that treatment foster care.
I was going to mention that in follow-up, that despite the clear benefits of this treatment option for children with significant mental health, behavioral, and sometimes medical needs, current law does not provide any sort of standard definition of treatment or therapeutic foster care under the Medicaid program in particular. And though these services are provided across the country and are often reimbursed through the Medicaid program, and certainly other child welfare funding streams, the lack of a federal standard definition has, in the evidence that I've gathered, affected both quality and access across the country. So I wanted to reference the legislation that I recently introduced, bipartisan, along with my colleague Senator Portman of Ohio, that establishes a federal definition for Medicaid of therapeutic or treatment foster care. I wonder, and I was pleased to see that Boys Town was one of 265 national organizations that last week sent a letter to House and Senate leadership endorsing the legislation. Can you speak to how the passage of the Quality Foster Care Services Act would improve care for youth, given the need for the high-quality therapeutic foster care services across the country.
Yeah, I think by standardizing that definition, that goes a long ways. I mean, and by providing the opportunity for the states to use Medicaid dollars, because it is different in various states. Some do use Medicaid dollars, others do not. By allowing that, it provides that, as I said, that intermediate level of care, and not necessarily long-term care where the child would stay there for an extended period of time, but as a transition to step down to that lowest level of care that would be appropriate for that child.
Thank you.